Well, thank you very much. That's the challenge we have, and we have to deal with. And now the whole world is speaking NCDs. Nobody can decline joining that. The WHO is speaking NCDs, and governments are speaking NCDs. Last year, in the year 2014, the Ministry of Health in Egypt developed an administration for non-communicable disease and still working so far. So that's the way the whole world is dealing with the problem right now, and we have to understand the whole thing. It's, can I move it from here? Okay, that's fine, thank you. Traditionally throughout, well, I have 5 minutes. Traditionally throughout the history, communicable diseases used to kill people. During the last few years, non-communicable disease started to kill people more than communicable diseases. What are NCDs? NCDs are non-communicable diseases. This is the term. And because of that, every part in the world, they are trying to develop NCD alliances, tahaluf, between different NCD specialists to work together because it's a common sort of problem. These are the death rate just 3 or 4 years ago in our region, the EMRO region, East Mediterranean Regional Office. We call it in the International Diabetes Federation, EMRO office. East Mediterranean, North Africa, we call it MENA region, Middle East and North Africa region. It's geographically the same area. And you can see here that non-communicable diseases are killing almost 57% of the people compared to accidents and communicable diseases. And in 3 countries, for example, here in Egypt, in Lebanon, where Sam is coming, in Tunisia, there are between, well, more than almost 85% of deaths are attributed to non-communicable disease. This is the effect on the economy. It's not just effect on the medical aspects, but economic aspects as well. You can see the socio-economic cost of the non-communicable diseases because globalization of urbanization and aging of the population will increase exposure to the risk factors, leading increase in non-communicable disease, increase healthcare costs, and all of that will lead to loss of income in different societies, in different countries, and that will lead to poverty when these non-communicable diseases are prevalent. And you can see how prevalent these non-communicable diseases are. Well, they are killing 85% of our population. These are the risk factors. You have seen them in the movie we saw just now. And you can see these are the basic 4 components of the non-communicable disease: cardiovascular disease and stroke, diabetes, cancer, and chronic lung diseases. And you can see that these are the 4 risk factors: tobacco use, unhealthy diets, physical inactivity, and harmful use of alcohol. They don't use of alcohol, but harmful use of alcohol. But increasingly, the use of alcohol is considered harmful at any level. There are reports about that just appearing right now. So you can see that heart disease will be affected, and diabetes and cancer will be affected by the 4 risk factors, and smoking might be, lung disease will be affected more with smoking, of course. So if we can tackle that area, we can have the whole group being managed. The trends here in our area, well, most of the communities of the world, that the risk factors are rising. The 4 risk factors we counted just now, and uneven has major, there are major gaps regarding them. The magnitude of the problem of NCDs is progressively increases, and health systems are already overwhelmed in many countries. You can imagine how the health system in Egypt, for example, is overwhelmed by other issues. So this is an increasing burden of the healthcare system of the country. Commitment is not always translated into sustainable and effective actions. And this is very important. We have to have commitment, and we have already signed agreements to be committed to do something. And the way to do these things might not be done in the best way. And because of that, in the year 2011, there had been a landmark high-level meeting in the United Nations with a clear declaration regarding that. And the NCD Alliance was formed in the year 2009 by these four elements which I mentioned just now, illustrating the role of the civil society, the non-governmental organization, in facing that problem. And recently there had been a meeting in September 2015 in the EMRO office. They invited many non-governmental organizations just to try to establish. It had been a global alliance on the world level, and recently they are encouraging forming NCDs on national and regional levels. Here in Egypt, we did some work actually, and now we have people from facing the problem of tobacco smoking, dietitian, nutrition, healthy food, obesity, diabetes, and chest. These are the components which we have right now. We applied at an NCD Alliance, Egyptian NCD Alliance, to join the global NCD body. We formed it. These are our members. We applied to the global NCD, and we hope will be accepted. I'll stop here, just leaving my friends just to continue giving just short hints, and Samir, I'm sure, will continue after that. Thank you.
Thank you very much. So I'm going